friends, I'm Dr. Biren Nadkarni. I'm consultant orthopedic and joint replacement surgeon. I'm practicing at Sitaram Bhartiya Institute and Holy Family Hospital, New Delhi. In this video, we are going to talk about post-Covid AVN. AVN stands for Avascular Necrosis of Femoral Head. And AVN is a problem which is characterized by decreased blood supply of the head of the femur. As we know, the hip joint is a ball and socket joint. Ball or the head of the femur rotates in the socket. And there comes a time when the blood supply of this ball reduces and it leads to a problem called avascular necrosis. So it's a distinct pathological entity in which once the blood supply reduces, the head of the femur collapses ultimately, leading to secondary osteoarthritic changes in the hip joint. And that is the main cause of the hip pain. There are many problems, there are many reasons of AVN. Earlier we used to see a lot in people taking steroids up to a level which has been shown in literature, and alcohol intake, and there are some rare causes also. But post-COVID, we have seen some resurgence of AVN of the femoral head, and the reason probably has been the usage of steroids in the COVID era, which was a very essential drug for the management of patients with lung complications. There have also been seen some patients where even the steroids were not used. AVN, the problem of AVN has been seen to be a complication of long COVID or some blood supply problems which has happened because of COVID per se also. But this is under conjecture and it has not been proven till yet. But mostly the AVN cases we are seeing in our practice, day-to-day practice, are because of whatever steroids have been used in that time. So AVN has various stages. In fact, stage 0 or stage 1 is a pre-collapse stage. Pre-collapse, when the ball is maintained its sphericity, it has not collapsed, and it cannot even be seen on the X-ray. The MRI is diagnostic and the MRI tells us that somebody is having AVN. Or even the stage 2A, which is the very early stage where we can see the collapse has not happened. See, these are the stages where we can treat. There are specific drugs, there are specific procedures, and we can go ahead and treat the patient. It is only once the head has collapsed, the sphericity of the ball has not maintained and it collapses, then only we say that the problem is worsened to a stage where normal procedures will not work and total hip replacement might be warranted. Basically, there are 4 stages of AVN, but it would be too technical for me to talk on this video. But all I can say, there is a pre-collapse stage and there is a post-collapse stage. The pre-collapse stages are basically stage 1 and stage 2, where we understand early management with basic procedures like core decompression might work and can give you a satisfactory lifestyle. There is also a role of some drugs called bisphosphonates, which used on a weekly basis for a period of 6 months to a year, also help us come out of this problem. For the diagnosis of this, along with the X-ray, MRI is absolutely essential, and we have to stage it according to the MRI diagnosis. It is the post-collapse stages. Once the ball has not maintained sphericity, it has collapsed and it is not in the proper shape, sphere-like shape, which leads to secondary osteoarthritic changes in the hip, where the treatment is more radical and we have to consider total hip replacement. I hope in this video you've been able to gather information about avascular necrosis of femoral head, the problem with it, and the causes which actually cause AVN. If you have any more queries or questions regarding this problem, you can contact us. Thank you.